GERD, acid reflux, and heartburn? What are the differences? Did you know we consume over 1 billion chicken wings and 10 million pizzas every year? Then, we drink more than 300 million gallons of beer to wash it all down. Resulting heartburn frequently causes antacid sales at 7-Eleven to increase by 20% the day following the big game. Heartburn affects around 60 million Americans on a monthly basis, impairing quality of life and interfering with daily activities. It is not a symptom that only occurs on one Sunday in February. But what is the underlying science of heartburn? If you're new here to this channel, and like learning new things, then hit the subscribe button down below, and hit the notification bell, so you don't miss any of our future videos. Understanding GERD, heartburn, and acid reflux. Although they have diverse meanings, the terms acid reflux, heartburn, and GERD are sometimes used similarly. The backflow of stomach contents into the esophagus is known as acid reflux. Acid reflux causes heartburn, a slight burning sensation that frequently happens after meals or while one is lying down. A more severe form of acid reflux is gastroesophageal reflux disease or GERD. The continuous backflow of stomach acid that characterizes GERD gradually harms the body. Particularly, esophageal irritation brought on by stomach acid might result in life-threatening consequences. It may be challenging to swallow due to the esophagus's narrowing from chronic damage and inflammation. Additionally, the illness might lead to pain and ulcers. Because stomach acid erodes tooth enamel, severe GERD may also cause asthma symptoms, a persistent cough, or dental issues. It may, in rare circumstances, result in esophageal cancer. A weak or relaxed sphincter in the lower section of the esophagus is a common cause of GERD. It permits stomach acid to backwash into the esophagus like a hatch that doesn't quite close. Heartburn, a burning sensation in the throat, and a sour or bitter taste in the mouth are all possible symptoms of GERD. There may be a sensation of food, fluids, or stomach acid entering the throat called regurgitation. It's typical to have nausea, vomiting, and other stomach discomfort, as well as pain or trouble swallowing. People occasionally confuse the symptoms of GERD with heart attacks. Arm discomfort is a common side effect after a heart attack along with heartburn and chest pain. Call 911 if you encounter these symptoms. Getting aid for GERD, acid reflux, and heartburn. Almost everyone has acid reflux and heartburn, though those who smoke, are overweight, take certain drugs, or are pregnant are more likely to have these symptoms. People frequently question whether they need to consult a doctor. It's time to get it checked out if the heartburn is persistent, severe, and unresponsive to over-the-counter medicine. The same is true for heartburn that hurts or prevents you from enjoying activities. When heartburn is accompanied by any of the following symptoms, including bleeding, nausea, vomiting, or trouble swallowing, a persistent cough, or worsening asthma, it's important to get medical attention. Patients with heartburn are frequently referred by doctors to gastroenterologists, medical professionals who focus on the digestive system. Next, the gastroenterologist makes a list of symptoms. Patients with heartburn can assure more comprehensive care by listing symptoms before the appointment. An endoscopy is a type of diagnostic test that the gastroenterologist may recommend. The patient is sedated and transitions into a twilight state during this operation. A thin, flexible tube with a small camera attached is inserted into the patient's throat by an expert. The gastroenterologist can then inspect the esophagus and, if necessary, collect a tissue sample for examination. Overcoming heartburn, acid reflux, and GERD. There are treatments available for people with GERD, acid reflux, and heartburn. To lessen the frequency and intensity of symptoms, doctors may advise making some changes in lifestyle. Common trigger foods include citrus fruits, tomato-based foods, onions, garlic, and chocolate should be avoided. Foods that are fried, heavy in fat, or spicy are also common triggers. Some drinks, such as alcohol, carbonated drinks, coffee, and tea, can cause GERD and acid reflux. A change of clothes may help because sometimes tight clothing might push stomach acid into the throat. It may also help to stop using tobacco products, like cigarettes. Additionally, you can lessen heartburn by raising your head in bed and skipping meals at night. In addition to lifestyle changes, there are therapeutic alternatives. Antacids may provide relief, H2 receptor blockers may lessen the formation of stomach acid, and proton pump inhibitors may prevent the production of stomach acid.
And that's the end of this video. Thank you so much for watching. I'll see you in the next video.